Hi, my name is Jamie and I'm going to be your nurse today. I understand that you can't speak, so how about you do a thumbs up for yes and a thumbs down for no? Is that okay? Thumbs up, yes? Okay, good. So, are you Lisa Smith? I'm going to go ahead and double check your identity first. Yes? Okay. And were you born June 1st, 1970? Thumbs up? Okay. And do you have any allergies? No? Okay. I confirmed against your wristband and that all matches, so that's good. So what I'm going to do today is I'm going to suction out your secretions and replace your inner cannula. Then I'm going to assess and clean the site and make sure that there's no signs of infection. And lastly, I'll replace your neck stabilizer so you have a new clean one. Does that sound okay? All right, good. Do you have any questions or concerns before we get started? No? Okay. And are you in any pain? No. Okay, that's good. So first, I'm going to check your vital signs. Looks like you're not using any accessory muscles to breathe, so that's good. But your respiratory rate is 22 breaths per minute, and your oxygen sats are at 92%, so that's a little low. I'm going to auscultate your lungs. Is it okay if I go beneath your gown? Okay, good. And I cleaned my stethoscope before I got in here, so I know it's clean. I'm going to have you take a deep breath in and out for me. Good. In and out. Good. In and out. In and out. In and out. In and out. Okay. Yeah, you sound gurgly, so you'll need some suctioning. I made sure to close the door before I got in to maintain your privacy. I'm going to put you in semi-Fowlers. And I'm going to put this towel on you. This is just to protect you from any secretions. And I also have a mask and goggles on to protect myself. So I'm going to go ahead and do an equipment check. It looks like there are two trachs in the room. One is size 8, which is your size, and the other is one size smaller, size 6. There are two inner cannula. One is the one I'll be replacing, and then I also have a spare just in case. Looks like there's an ambu bag attached to 100% oxygen. And it's working good. We've got suction catheter. This is attached to continuous suction at 120 millimeters mercury. That's also working, so that's good. I don't know when this was last replaced though, so I'll make sure to replace that with a clean one before I suction you. So first I'm going to put on some gloves and wipe down my table. Okay, so I'm going to get a sandy wipe. There we go. I'm going to make sure that I clean this table for at least 30 seconds. And while I do that, I'll go ahead and explain the procedure to you. So before I suction you, I'm going to get the ambu bag and I'm going to hyperoxygenate you. I'm just going to give you a couple of breaths so that you have air before I suction you. Does that sound okay? Thumbs up? Okay, good. Make sure to clean the outer perimeter of the table. Alright, so it's been at least 30 seconds. I'm going to go ahead and wait at least 2 minutes for that to dry. Okay. I'm going to go ahead and put my supplies on the table. I got your neck stabilizer, got a saline box, extra pair of sterile gloves, two inner cannula, and I've got the saline. Just put this to the side. I'll move that a little. Kind of just open up. There we go. Got the inner cannula in the tray kit, so it's ready for when I need it. Okay, so we're going to put on some clean gloves. First thing I'm going to do is I'm going to pour some saline into the saline box and in the Trach kit so that it's ready for when I need it. Okay, so here's the box. There. Pour that. Pour it in here too. Alrighty. And then I'm going to take off this catheter, this old suction catheter, put that in the trash, and I'll just put that to the side for now and put on a new pair of gloves. I think this one might have touched my scrubs. So I'm gonna put on a new pair. There we go. Alrighty, so, and voila, you got a brand new suction catheter ready for you. And I'm gonna trace it back. Okay, so I've turned on the suction. It's set to 120 millimeters mercury, continuous suction, and it looks like we're all set. So the first thing I'm gonna do is I'm going to hyperoxygenate you before I suction. So I'll get this ambu bag ready. Okay, so I'm going to just stabilize this faceplate while I remove that. Okay, here we go. 1, 2, 3, 4, 5, 6. There you go. You doing okay? Your oxygen sats went up to 97%, so that looks good. I'm going to go ahead and suction you now. Alright, here we go. There we go. Are you feeling okay? Good. Do you need me to suction again? No? Okay. So if I did suction you, I would just wait 30 seconds before that repeat suctioning, but it looks like you don't need it. Your oxygen sats are at 97, so that's good. Alrighty, so time to put on a new pair. So now I'm gonna put on my sterile gloves. Okay. There we go. Alright, so let's see. I want to make sure that I'm only touching the inside part, which is the part that's going to touch my skin. There we go. now that they're on, I can go ahead and adjust everything. This is okay, I'm maintaining sterility because this is the sterile part, touching the sterile part. Okay, I'm gonna drop that into the trash. Okay, now we're ready. I'm gonna go ahead and put this sterile drape on you. There we go.
I'm so sorry.
This is for just in case I drop my inner cannula. It'll save it. There we go. Okay, you doing okay? Okay, good. So I'm going to move the sterile gauze. Move some of it into the saline compartment. I'm also gonna dip my Q-tips into the saline compartment so that they're there for when I need it. Alrighty, so I'm gonna go ahead and time to take off your oxygen. So I'm going to hold on to, I'm gonna remove your oxygen. I'm going to hold on to the plate while I remove this. I'm gonna dump that into the trash. And I'll put the new one in. Like that. There we go. I'll also remove your old dressing. Okay, so that's removed. I'm gonna go ahead and put your O2 back on. Okay, there we go. Are you doing okay? Okay, good. All right, so I'll let you breathe for a second before I check. What I'm going to do next is I'm going to assess the site and make sure that there are no signs of infection. So, alrighty, so there are no cracks or signs of displacement on the trach tube. Your plate and your stabilizer both look like they're in good condition and they're both secure. And there are no signs of infection in the area. So that's good. I'm gonna go ahead and clean underneath. One swipe. And then I'll clean underneath with one swipe. Good. Now I'm gonna use the wet gauze. And I'm going to wipe on top. There we go. Wipe on top. I'm going to get this dry gauze. And I'm going to pat, pat, pat. Pat, pat, pat. There we go. Drop that into the trash. I'm going to put your slit gauze underneath. There we go. Are you feeling okay? Okay, good. Okay, so now we're ready to put the next stabilizer on. This is the part where I would have an assistant, but I don't have an assistant with me today, so we're going to pretend that my assistant is here. My assistant would just be holding down on this faceplate while I replace it. So we're going to pretend that they're holding on that. Okay. So I'm going to remove that. All right, so now that that's exposed your skin, I'm gonna check. And it looks like there's no signs of redness or excoriation on the skin. So that's good because this is a site that's that, you know, if there's moisture, then that increases your chances of excoriation. All right, I'm gonna feed this through. Okay, can I have you lift your head for me? Okay, good. Now that your back of your neck is exposed, I'll just go ahead and check, and there are no signs of redness or excoriation on this side either. So that's good. Okay, so I'll remove this part and dispose of that. Okay. I'm gonna check the fit. Okay, so I've confirmed that I can fit 1 to 2 fingers in there, so it's not too tight and not too loose. That's good. Alrighty, so we're all done. I'm gonna go ahead and check your vital signs while I remove this. It looks like your oxygen sats are at 98%, so that's really good. And your respiratory rate is 17 breaths per minute. You're not using any accessory muscles to breathe. That's also good. So I'm going to do hand hygiene, clean my stethoscope with alcohol. Can I auscultate? Can I go under your gown? All right, thank you. Deep breath in and out, 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 in and out. Okay, good. You're no longer gurgly. Are you doing okay before I leave? Okay, good. Are you in any pain? No? And do you have any questions for me? No. Okay, good. So here's the call bell. I'll put it in your hand. I'm gonna lower your bed and put the side rail up. And I'm going to dispose of everything. So the emergency equipment is here. I put a clean suction catheter there for you. So I'm gonna go ahead and document the date and the time of this procedure, the condition of your skin, your tolerance of the procedure, the number of times that I suction you. I'm going to also document your vital signs and my respiratory assessment. And I'm going to document that you had minimal clear white secretions. So I'm gonna go and I'm going to check in on you later, okay? Alrighty, thank you.